One of the things patients often ask about is fat grafting versus hyaluronic acid fillers, and why can't we use fat grafting which is permanent or hyaluronic acid fillers which dissolve. So they're actually quite different, and I want to talk to you a little bit about why this is. So hyaluronic acid fillers are a safe, sterile treatment. They come in pre-prepared syringes and it's like a thick gel. They've got viscosity and a three-dimensionality to them. So if I injected some filler on this operating table, it wouldn't be a liquid at all, it would be a tube, a little bit like toothpaste. If you inject toothpaste onto this, you're going to get a tube of toothpaste. And even though filler's clear and a bit more soft than that, in terms of density, it's not all that dissimilar. So a small amount of filler can push things out and project them. So they're really good, for example, lip structure. As we age, our lips become softer and we lose that teenage, well-defined structure to the lip. So filler's great for that because of its three-dimensionality and its accuracy. It's good for filling wrinkles, and it's good for flat cheeks where it will give you projection and volume. Fat, on the other hand, it's like water. If I harvest fat for fat cell grafting, we use microfat harvesters, and then we just spin off or let the fat stand, so any blood waste or fluid waste can be extricated from the fat, and we've got this beautiful little yellow tube of fat. When that goes in, it has volume, but it has no viscosity. It's got no projective capacity. So it pumps things up in the same way that pumping air into a football or a basketball would work, or pumping water into something. So think of it as you're swelling an area by injecting water. So in a flat cheek, or someone who's got temple volume loss or general weight loss of the face, fat's terrific because it re-inflates, but it doesn't have that fine projective capacity of filler. So I think fat, for example, is terrible in lips. It just gives you a featureless, swollen tube. It doesn't give you a beautiful, fine, structured lip. And so around the mouth, for example, let's say someone's a weight loss patient and they have loss of volume around their whole mouth area, then I would certainly use fat to add bulk to that area. But I wouldn't use it to enhance the lip, even if they didn't have much visible lip. Filler would then be used to enhance the lip edge. It's not a volume thing at all. It's a shape and beauty thing. Having a sharp edge lip makes you look younger, better. It makes lipstick look better. It's an awesome thing to have, but fat's not going to do that trick. Fat is permanent. Filler is not. However, to understand the way fat works is that if I inject live, fresh fat graft carefully into the face using best practice technique, we think around 30% to 50% of the fat cells that are grafted will stay. That would be a typical range, I would say, to patients. So from a patient experience, your experience is that you lose volume for a couple of months after having fat grafting, but then you stabilise. Many people think that they've lost all the fat, but they haven't. When we look at pre and post-op pictures, you can see the volume there. So the applications of the two are quite different, and often we're using both. And Dr. Face, the Dr. Face team and I will often discuss a patient together and come up with a plan that might have some fat grafting for bulk volume enhancement to somebody with a thin or wrinkly face, but all of the areas where you want projection, such as the mid-upper cheek, such as the lip, are much better treated with filler. As a guide again, I would overcorrect you with fat and aim that 30 to 50% of the fat cells, or predict that would be what we should expect in a typical case, would remain permanently and give you a permanent volume increase. So hopefully that lets you understand our thinking in discussing fillers versus fat grafting, or a combination of the two, to achieve the best outcome that we can for you.